Segment is sponsored by Austin CyberKnife. Well, September is National Prostate Cancer Awareness Month. Designating a month for the disease serves the purpose of increasing public awareness of the importance of prostate health and screenings, educating about risk factors and symptoms, and advocating for further research on prostate health issues. Here to talk more about prostate health is Dr. Rivera and Dr. Laviana with Austin CyberKnife. Good morning.
Morning, Stephanie.
Thanks, Stephanie. Thank you so much for having us today.
Well, thank you for being here. We've got a lot to cover today. So, Dr. Laviana, I'm going to get started with you and ask you about what are some of the risk factors that might affect a man's risk of actually getting prostate cancer?
Really, there are three main risk factors that can increase your risk of prostate cancer. The first is age. So prostate cancer is very rare in men less than 40 years of age. However, once over the age of 50, your risk increases quite substantially. And then once you hit 65, about 6 in 10 cases are in the age group of 65 and older. Another risk factor is race and ethnicity. And this has been studied quite extensively, but black men have a 2.5 time rate of dying of prostate cancer versus non-Hispanic white men. The reason for this, however, is not genetics, but is more due to quality of care and societal factors. And the third biggest risk factor is a positive family history. And so having a brother or father with prostate cancer substantially increases your risk. And there are some genetic mutations that can be passed down.
And can you talk to us about some of the signs and symptoms that are associated with prostate cancer?
Prostate cancer, for the most part, is silent. The majority of men are diagnosed with prostate cancer that has not spread. And at this time point, it's really patients are asymptomatic or not showing any signs and symptoms. As the prostate cancer can progress and get worse, then men can develop urinary symptoms, difficulty going to the bathroom, having obstructive symptoms, getting up many times at night. If the cancer has spread to other parts of the body, then it can get very painful. It can spread to the bones, and you can get hip pain or other types of joint pain and things of that nature.
And can you talk to us about some of the current statistics for prostate cancer?
Prostate cancer is the second most common cancer in men. However, approximately 31,000 men die of prostate cancer every year. About 300 to 350,000 men are diagnosed. So the majority of men are diagnosed with prostate cancer, but fortunately do not pass away from it. In Texas alone, approximately 14,000 men will be diagnosed with prostate cancer this year.
And can you talk to us a little bit about how prostate cancer is actually diagnosed?
The main way prostate cancer is diagnosed is ultimately through a prostate biopsy. That's where we actually get tissue and look at it under the microscope to make a diagnosis. The screening test for prostate cancer is a blood test called prostate-specific antigen, or PSA. It's a blood test that shows your risk essentially for having prostate cancer. You can also do a digital rectal exam and feel a nodule, but those two alone will not diagnose it in and of itself. We can also get a prostate MRI to identify lesions that may be of concern, but the only way to truly diagnose it is with a prostate biopsy.
So Dr. Rivera, men diagnosed with prostate cancer are treated with the CyberKnife Robotic Radiosurgery System over at Austin CyberKnife. Can you talk to us a little bit about CyberKnife and what it is?
It is something that specializes in doing focused radiation, and in doing so, it can do it in 5 treatments or less, which is historically compared to other machines that are out there. Prostate radiation typically took 8 to 9 weeks, and even now with some shorter regimens, it's still often 4 to 6 weeks. So in regards to CyberKnife radiotherapy, it's something that we can do in as little as 1 week.
Dr. Laviana, can you add to that a little bit with your background and expertise?
Our goal here is to minimize treatment regret. And there are many different options out there for prostate cancer, and sometimes it can be overwhelming with all the options. However, there's 3 things we want to prioritize here. The first is cancer control, so trying to cure the cancer or getting as much cancer out of the body as possible. The second is urinary incontinence or leakage of urine after treatment. And the third is preserving erectile function if possible. And it's weighing all 3 of these together, and it's an individual sort of prioritization there on how all 3 are prioritized. And so it's going over all the treatment options with the patient and seeing what the best fit is. Whether that's CyberKnife, we can remove the prostate robotically via surgery. There's also high intensity frequency ultrasound. There's sort of partial ablation of the prostate, There's proton beam therapy and other treatment options here, but it's really just understanding with the patient what they prefer and how we sort of prioritize these three things.
Now, Dr. Rivera, I want to dig just a little bit deeper on CyberKnife. How does it actually compare to conventional radiation therapy, and how does it work?
They're organ-preserving type of treatments, meaning that we're treating the prostate and trying to preferentially kill cancer cells. So with CyberKnife, it's focusing in a very targeted way using a higher dose of radiation per treatment. So it's really able to kind of spare the normal tissues around and truncate it into a much shorter duration than conventional radiation.
Dr. Rivera, I want to start with you here. Can you just kind of talk to us about some of the biggest benefits that you see and you hear about from patients that CyberKnife actually does for prostate cancer treatment?
We'll recommend one treatment over another and kind of personalize it based on the person's medical history, their expectations regarding outcomes, and maybe even type of cancer they have. But for those folks that are good candidates for the radiotherapy aspects and doing CyberKnife, it really is a non-invasive type of treatment. There's painless type of delivery of their treatment that is highly curative. And so for patients, they see us, and we were the first people to do this 5-fraction radiotherapy in the Central Texas area and continue to be at the forefront of doing it probably the most often compared to anybody else in this area.
And Dr. Laviana, is there anything you want to add?
Yeah, I think one of the biggest things is the technology has just gotten so much better. They can really hone in and target the prostate alone, and you don't get the side effects of targeting the other organs. But being able to do this collaboratively, I think the patients get a better outcome.
We're going to really drive it home here, and I'm going to ask you, talk to us about why a man diagnosed with prostate cancer should consider Austin CyberKnife for treatment.
Dr. Laviana just touched on that. That's the collaborative care that we provide here, having been the first folks to have done it and continue to be the leader of doing a large number of patients day in and day out the same way. It's built up a certain level of expertise within our center and all of the staff and therapists that work with our patients. And so I think the experience is a high quality experience.
And Dr. Laviana?
I think being plugged in with a urologic oncologist and a radiation oncologist to truly understand the full arc of treatment and sort of the expectations and as well as those treatment options, I think really adds a lot of value.
Guys, thank you so much for joining me this morning. I know I've put you through a lot of questions here, but you answered them so wonderfully. I appreciate your time, and I look forward to seeing you both again.
Thank you.
Thank you so much.
This segment is sponsored by Austin CyberKnife.